Hello, everybody. Welcome to Dental Voice on the Case with Xyrus. My name is Rolando Mia. The purpose of Dental Voice on the Case is to hear from clinicians how they overcome issues that they face on a day-to-day basis. Today, our guest is a returning Dental Voice clinician, Dr. Paul Bylis, owner of Innovative Dental in Maryland. Good morning, Dr. Bylis. How are you?
I'm doing well, Ro. How you doing?
Really well, thanks. Thank you so much for joining us. Looking forward to taking us through how you basically treat a patient with failing class 5 restoration. So go for it.
Excellent. All right, so today I want to talk about how my team can consistently achieve excellent clinical outcomes on our restorative procedures. And the way we do this is using isolation that allows us to reduce distractions, actually eliminate distractions. We use isolation that allows me to have the ability to work alone. And we use isolation that allows us to maintain a great treatment environment as it relates to moisture contamination. If you could roll the video. So in this case, we're treating James, who has overcome obstacles in his life as far as it relates to addiction. He's successfully gone through rehab and is now a contributing member of our community. We're honored that we can treat his smile so he's not prejudged by society. Also, we could get him out of pain and furthermore give him function, not just for the short term, but for the long haul. So today what we're going to concentrate on, we did this entire quadrant of restorative, but we're going to concentrate on class 5 restorations we did on teeth numbers 27, 28, and 29. These restorations, unfortunately, are less than 2 years old and have to be replaced. So how are we going to go about doing that? So if you can see, I talk about no distractions. I can concentrate exactly on what I'm doing because the patient's on the bite block of the mouthpiece. The tongue is resting comfortably behind that piece of plastic. And we don't have to have a conversation on open, open, open. Try to relax your tongue. My team is not fighting to get the environment. He's very comfortable. I also have the cheek retracted, which gives me a beautiful vision down the corridor. And you can see as heavy, copious irrigation is going on, it's a non-issue. I don't need any augmentation from my assistant to help with that. And the light level, I have 3 light levels that contribute to low stress and allow me to do my job where I don't have to concentrate on any peripheral issues. Furthermore, you'll see later we'll use the amber so I never lose visualization. As far as working alone, in my office we have an amazing team of professionals, but we're a lean team and my workflow depends on my assistant staying mobile. With Isolite, I don't need to have my assistant tethered to the operatory, with performing the mundane task of retraction and suction. I can free her up to use all her, maximize her skill set. She enjoys that more. We maintain a better workflow for it. There's not a day that goes by. We all have walkie-talkies. And there's not a day that goes by where we don't get a call that Mrs. Smith wants to do an Invisalign start. Well, that doesn't disrupt my workflow. She, I'll see it, I'll nod. She seamlessly leaves the room. Next thing I know, we have a CEREC scan, we have the photographs, the patient is scheduled, and she's back in the chair. Hygiene can call down the hall that Mrs. Jones wants to start a implant treatment plan that we suggested 6 months ago. And we can let the assistant go, take the CBCT, take the intraoral scan, start our guided surgery planning. She walks it to the front. It's not disruptive to hygiene. It's not disruptive to my front desk. And I'm still producing and haven't missed a beat. What you see here is me packing cord to maintain a proper field for these restorations. When we talk about moisture contamination, we have issues in dentistry where, class 2 failures occur in the proximal box. And where in the proximal box? At the gingival junction. Well, where do class 5s fail? At the CEJ. They're not failing in the middle third. So there are issues as far as controlling the environment that we work in. So obviously, having this device to shut down that moisture, even from his breath, is huge for us. And we're packing cord to make sure that we ensure that we have an environment that has no leakage of fluids into it, because it's a difficult area to treat. One of the, as far as materials, pearls that we can take away, you're going to see me adding SDR Flow Plus. It's a can't live without in my practice. We use it because of its properties of self-leveling, where it will actually go ahead and seal on its own, wait 5 seconds, and then cure. If you're going to handle the tissue at that junction, there's a risk of fluids, there's a risk of bleeding, and you're never going to be able to get the material as well adapted as you can with this material self-leveling for you. Furthermore, use of SDR Flow Plus is will have no patient post-operative sensitivity in your class 2s, your class 5s, any of your restorations that you put it on there. Because of its proprietary chemistry, whereabouts it allows for conformational flexibility, where the stresses on the walls, okay, are mitigated through the long chain chemistry and with modulators in it, and don't cause that stress. You see me adding it there. It makes you faster, it's void free, it's a better seal. Okay, and then we cover that, as you'll see, with a microfill. And in my practice, we use microfills on all class 5s. And one of the main reasons is that on a class 5 restoration, you have you have some flexure at that junction, and this material is highly unfilled and allows for flexure. Second reason we use the microfills is that the microfills have high polishability, and that high polishability will allow for less plaque accumulation. And thirdly, it's the most color stable material that we have as far as a resin. And the class 5 restoration in my practice is a cosmetic restoration, and we want it to look beautiful. So it's very important to us to get that type of material in there. And the product we use is Renamel by Cosmedent. It's, I think, the best microfill on the market. And as far as instrumentation, I'm using a Cosmedent plastic filling instrument right now, but my fave is the Goldfocal number 3, which should be coming up in a few seconds, which is made by Ufridi, and there it is right there. And I just love the shape. I use that for all my class 5s, all my direct resin, direct veneers. That's a can't live without for me. And right now you see adding the material, final cure, and there we go. And we're coming to the end of where we just would need to polish and see our results. Okay, there we go. See that? And there we have, this is the last quadrant we were treating. We have a situation where now the patient is caries free. He's got a functional dentition for now. The next phase will be to, plan for any full coverage restorations he may need, and implant planning for the future for first molar replacement in all 4 quadrants. And that's what we got, Ro.
Holy cow! First of all, absolutely amazing, and I love the kind of the structure and how you kind of navigate through that case. Couple of quick questions here.
Sure.
First of all, I love the fact that during the course of your treatment, there's I can see that there's a cadence. Rubber dam, if we understand correctly, is kind of the key. Could you have used rubber dam for this? Because it's still the standard and continues to be.
Yeah, I mean, it would have been a difficult area to clamp. We may have had to make a releasing incision and get a proper clamping on there. I mean, I'm not saying it certainly can be done, but all the other factors that the Isolite affords me, as far as controlling the patient's suction. I mean, in the rubber dam, I would still need suction. I would still need an assistant to be over me. This really frees me up and is much quicker for a workflow and to get the quadrant done. As I can't live without. For our purposes in my office, rubber dam would not allow us to have the same level of productivity and with the light source, with the control of every other factor that we get with Isolite.
Well, thank you for that. It's amazing to see the result that you had here, and the story that you told us about your patient and how he was experiencing. With regard to the kind of the aesthetic outcome that you have here, there was a lot of treatment. So, if I understand correctly, this is just one aspect of an entire case that you did here, correct?
Yeah. Mm-hmm.
What were the other, just quickly, what were the other things that you had to do with regard to treatment with your patient?
Well, unfortunately, he had a lot of hopeless teeth and posterior quadrants that we had to remove. Some of them, we were able to bring back to life, and we're planning on getting full coverage restorations on them. And we've got some grafting that we did from the extraction sites, and we'll be able to get, I think we have some beautiful platforms to do some guided implant surgeries and give him back. Really, once I get him to first molar, he should be in a great state of function. I mean, it's always gratifying to be able to help somebody like this.
Yeah, and that's fantastic. First of all, thank you so much for joining us, and thank you for taking us through this wonderful case. I love the work that you've been doing here, that you were doing here, and it's fascinating to understand why you do it and how you overcome some of the issues that you're facing. Those of you who are watching, if you want to get in touch with Dr. Bylis, or you want to ask him questions about the case or just things that he's doing, you can reach him at dr.bylis@bylisdental.com. Or you can check them out, Team Bylis, at their Instagram account.
Definitely check it out
on Instagram. Or you can go to their website for Innovative Dental at bylisdental.com. So please reach out to him. Dr. Paul Bylis, thank you so much for joining us. Thank you for sharing your case, your expertise. Please say hi to Dr. Elaine Bylis for us.
I certainly will.
I don't know, the apple, the pear, the doesn't fall far from the tree. So
not that apple. Yeah.
And also you got to say hi to Betsy and Matt. So there you go.
Sure will. I sure will. Right. Thanks, Rob.
Thank you so much. Have a great rest of your week, and we look forward to hearing from you. Those of you who, if you like this, please share it. If you have any questions, please let us know. Have a great week, everybody. Take care.
Thank you. Thanks, Rob.